Hi, welcome to Dr. Medics.
Phalanges. There are 14 phalanges. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. There are 14 phalanges. Each finger has 3 phalanges except the thumb one. Thumb has only 2 phalanges. The phalanges are of 3 types, that is proximal phalanges, middle phalanges, and distal phalanges. These are all proximal phalanges, these are middle phalanges, and these are distal phalanges. Phalanges has base, shaft, and head. First we'll see about the base. So in the base there is proximal phalanges and middle phalanges and distal phalanges. So this is the base. And the base is marked by concave oval facet, which is used for the articulation of head of the metacarpal bone. And in the middle and the distal phalanges, there are two oval concave facets which separate the smooth ridge. Shaft is the one that tapers the head of the bone. Dorsal surface is convex from side to side, and palmar surface is flattened from side to side. Head. The proximal and middle part of the head is pulley shaped and is articular surface, whereas in the distal part there is a horseshoe type of tuberosity which is non-articular and supports the sensitivity of the pulp of fingertips. Attachments. The first attachment is the base of the distal phalanges. In the palmar surface, flexor digitorum profundus is inserted, and in the dorsal surface there is a ligament that is two side slits of digital expansion. In the dorsal surface, the lumbricals and interossei muscles are inserted. Second attachment is the middle phalanx. There are two slits of flexor digitorum superficialis, flexor digitorum superficialis on the sides of the shaft, and the fibrous flexor sheath is attached to the sides of the shaft, which is the ligament, and the extensor digitorum is inserted in the dorsal surface of the base through the dorsal digital expansion. Third one is the proximal phalanx, which is the fibrous flexor sheath attached to the sides of the shaft, and on each side of the base lumbricals and interossei muscles are inserted, and the thumb is the next one. It has three sets of attachment. First one is the adductor pollicis brevis, and flexor pollicis brevis, which are inserted in the lateral side, and in the medial side there is an attachment which is the adductor pollicis and first palmar interossei muscles attached in the medial side. And in the dorsal side of the thumb, there is the attachment which is called the extensor pollicis brevis in the dorsal side. And the last one is the little finger and the medial side of the base of the proximal phalanx, which is inserted by the adductor digiti minimi and flexor digiti minimi.